Hi, there's Dr. Patrick. I'm going to go over the importance of 3D X-rays and panoramic X-rays and explain why it is that we encourage all of our patients to get either a 3D X-ray or a panoramic X-ray if you're younger. So you've probably seen a panoramic X-ray before. It shows you kind of your whole jaw, all your teeth. We can see your sinuses, we can see your TMJs. It's very helpful. Lets us see things that we can't see in individual small X-rays. Now there is a lot of information that is missing or that is blurry because of there's so much going on. So on children we'll often do these. It gives us a lot of information like, okay, are all of the teeth there? Now on an adult, I recommend a 3D X-ray. If I'm looking at you and this is your 3D X-ray, I'm able to see the overall shape of your teeth. Maybe you're in here to talk about Invisalign or clear aligner orthodontics, maybe braces. We're able to talk about that very easily when we can see all of your teeth and how they're laid out in your mouth. The other thing I can see is the bone around your teeth. Do you have gum disease? Do you have periodontal disease? Or maybe that's something that runs in your family. We can talk about that and make sure it looks like you've got enough bone around your teeth to keep them healthy. I'm also able to see in the back of your throat, we can see how much space you have in your airway. This can help us talk about things like why you clench, why you grind your teeth, why you snore, why you're waking up multiple times at night, or maybe why somebody else is waking you up multiple times at night because of snoring, or they're waking up and startling you or grinding their teeth. The other thing we can look at closely with the 3D X-ray is right around the roots of the teeth. Do you have any root canals that have been done in your mouth? We're able to often spot infections that can happen around a root canal or around a natural tooth. Maybe you've had some big cavities filled. Those can sometimes become abscessed later on. In 3D, I'm able to spot those often much sooner than I can in a 2D X-ray. If I'm going to be doing a root canal on somebody, I like to cheat a little bit. I like to look inside the tooth and know what it looks like inside. So I know how many canals it has. I know how long those canals. I know if they're curvy. So we can maximize our success rate on those root canals and those treatments. The other thing I like to kind of sneak peek on is on extractions. So I can actually change. This is a different patient, but I've changed the view to where I can see translucent teeth or bone. And so I can see inside and I can see if those roots are curvy. I can actually see where the special or important nerve is that we don't want to damage when we're doing extractions. And up here we can see this tooth is kind of curved. So I like to have this information so I can treat my patients as comfortably as possible and as successfully as possible. The other cool thing I like to do with a 3D X-ray is if somebody's missing a tooth, and we're talking about doing maybe an implant for them to give them a new tooth back. We can actually plan that implant. Here's that same patient with just a different software. We can plan that surgery or that procedure in advance, and we can simulate it. So now I've placed it in that person, and I'm also able to see things like their nerve that we want to make sure we keep safe. I can simulate how I want the tooth to look. With this information, I can then use our 3D printer that we have here in-house, and I can make a special guide that helps me place that implant right where I planned it in 3 dimensions on the computer. And this really maximizes our success, minimizes our chances of complications with damaging nerves and other things like that. And we can give that patient that tooth back as comfortably as possible. So that's one of the things we can do, and there's many other capabilities of a 3D X-ray. Like I'm also looking for things like tumors and cancer and things like that. When I'm evaluating that scan, I'm looking for those types of things. So I recommend all of our patients get this. At this point, I've been looking at 3D X-rays now so long, I'm amazed by the things that I can see that before I couldn't see. And I feel kind of like my hands are tied now if I don't have the ability to have a 3D X-ray on all of my patients. So I encourage you to get one. If you have any questions, feel free to ask. And as always at Rivers End Dental, we can't wait to make you smile.